Lateral shift, there's an asymmetry. I was sitting in a faculty meeting 20 years ago, and we're having a similar conversation amongst faculty, and Robin's getting frustrated. He goes, they walk in like this, they have a lateral shift. They walk in like this, they don't. That's how Robin viewed it. Well, we have to teach this stuff. We need to be a little bit more specific. I said, well, why don't we just put asymmetry? Why don't we just make that asymmetry instead of, and he goes, you could. That's all it means. They look to be crooked. She looked to be crooked. A relevant lateral shift is due to or came on as a result of the present symptom. That's what a relevant lateral shift is. The criterion is it needs to be visibly and unmistakably, the patient needs to be visibly and unmistakably shifted. There is an obstruction to side gliding in the direction that corrects the shift. They cannot correct it on their own. If they can correct it, they can't maintain it. Side gliding is painful, and repeated side gliding affects the intensity and the location of their symptoms. If they indeed do have a relevant lateral shift that needs to be addressed first, bless you, extension will make them worse. When you see a relevant lateral shift and you try to correct the shift, remember we were doing shift correction and I said they're going to scream. When we did movement loss assessment with Kathy, both directions were mildly painful. She hurt just as much accentuating the shift as she did correcting the shift, and it wasn't a significant movement loss. I put minimal loss. Well, somebody's got a structural scoliosis, leg length discrepancy, the pelvis is tilted. It's likely to see a minimal loss, or a loss anyway. I didn't see the pain response you would expect with a relevant lateral shift. So I exhaust the sagittal plane. Send her away with extension. She's 85% better. You don't know how bad I did not want to even look at lateral. She's very in tune to little things, right? I mean, the elbow, the neck, the knee, the ankle, the foot. I mean, things flicker around. You got to realize. I'm like, if I ignore this, everyone's going to be upset that I ignored it. Because again, she's